Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let's talk about congenital abnormalities of the uterus, also called as Mullerian duct anomalies. Now, it may sound extremely difficult and complicated, but in short, it is the anomalies or abnormalities of the uterus in a lady which are there right from birth. Now, whenever a lady cannot conceive, she comes to me and we do a detailed investigation which includes a 3D, 4D sonography which is known as a baseline sonography along with certain hormonal investigations. To our surprise, a few patients have abnormalities in the shape as well as size of the uterus, and sometimes patients do have duplicated uteri or absent uterus as well. So, all in all, these are abnormalities which are there right from birth of the patient, but the patient has absolutely no symptoms or no problems related to this till she comes to us saying that she has infertility. Now let us see how these problems arise when the baby is in the mother's womb. Around the 3rd month of pregnancy, the sex organs differentiation starts, which gets completed by the 7th month, and this is the time when the human uterus along with both the fallopian tubes and the ovaries along with the renal system or both the kidneys are developed. Now, during this phase, if the mother has any problems like fever or any infections or any other insults during the intrauterine phase, the embryo might develop abnormal uterine and reproductive system. So, these abnormalities can range from absence of the uterus, that is, the patient doesn't get menses at all and she comes to us that she doesn't have menses but she wants a child, and when we scan the patient we get to know that she is a patient of absence uterus and hence requires a surrogate mother or adoption. Some patients have duplicated uteri which are nothing but two buds of uterus which are present, which may be of the same size, which may be communicating with each other or non-communicating horns of the uterus, and which may sometimes land up the patient with excruciating pain during menstrual cycle, or they may land up because of twisting of one of the horns or torsion. These patients, if they present with septum, that is, some patients have just got a curtain in the uterus which separates the uterus into two halves. It may be a partial curtain which is known as a partial septum, or a complete curtain dividing the uterus into two halves which is known as a complete septum. Now, one good news is that the septa can be removed with the help of hysteroscopic metroplasty surgeries, with the help of advanced laser equipment, which is a daycare painless friendly surgery, after which once we remove this curtain, the uterus gets back to its normal original shape, and then the patient can be posted for artificial or assisted reproduction technology like IUI or IVF, depending on whatever she requires. Now, certain patients have these duplicated uteri, and sometimes they are also completely two different uteri, and unfortunately these patients may have problems during conception. So, all in all, if you are a patient with an abnormal uterus, do not neglect it. See your IVF physician, because you may be requiring certain surgeries to correct the shape and size of the uterus, but unfortunately certain patients do have major abnormalities right from birth which are known as Mullerian defects and who may require surrogacy or adoption. Thank you.